good. Hello, my name is Alejandra Villanueva, and I'm here with my partner Viviana Martinez. Today we're going to be talking about systemic lupus erythematosus. So what is lupus? Lupus is a chronic disease that affects a wide variety of organs in the body. It is an autoimmune disease, which means that the cells in our body attack other cells in our body. So instead of protecting it, they're attacking it. Lupus causes pain and inflammation to skin and other parts of the body, and there are 4 kinds of lupus: systemic, cutaneous, drug-induced, and neonatal. What causes lupus? There is no specific cause for lupus, but there are 3 risk factors that trigger the symptoms of lupus. They are hormonal, genetics, and environmental factors. Hormonal influence on lupus. SLE predominantly affects women during their reproductive years. Out of 10 people, 9 will be women. The Research Institute of Immunology in Korea investigated the effect of estrogen on activation-induced T cells in patients. The study demonstrated that estrogen has a big effect on T cells that go through apoptosis, thus triggering SLE activity. So this is, estrogen does have a lot to do with lupus. It's a big, it has a big impact on patients with lupus. Genetic and environmental influence on lupus. There's considerable evidence that lupus is a genetic disease passed on through families. The prevalence of lupus amongst ethnic groups: Asians, Hispanics, African Americans, and Native Americans. They are the ethnic groups that get it the most. Ultraviolet rays, prescribed drugs, antibiotics, viral infections, emotional stress, pregnancy, or injuries to our bodies are triggers to lupus. Susceptible genes. Type 3 hypersensitivity reaction. If a person with lupus is overexposed to sunlight, the cell's DNA will get damaged and eventually die. When the cell dies, it releases apoptotic bodies, and they release DNA, histones, proteins to the body. These are called nuclear antigens. A person with susceptible genes will have a hard time to get rid of these nuclear antigens, and they're gonna end up having a buildup of the nuclear antigens. That's when the B cells come and they recognize these antigens as foreign, and they try to attack it, forming Y-shaped anti-nuclear antibodies, which bind to these antigens. And once they bind to the antigens, they start floating through the blood, and they attach to the vessel of the walled vessels of organs and tissues, and that's what causes inflammation. Type 2 hypersensitivity reaction. The difference between type 3 and type 2 is that type 2 targets specific cells, such as the white cells and the red blood cells, and type 3 doesn't. Effects of SLE in body. Body's inflammatory response. So the antibody complexes, or the white-shaped bodies that bind to the blood vessels, they release cytokines. These cytokines bind to other cells in our bodies, and they also cause inflammation to tissue. And once they bind to the tissue becomes damaged, and that's when the symptoms appear. In lupus, there are flare-ups and remission. And if you are exposed to any of the triggers we talked about before, which are the genetic, environmental, or the hormonal triggers, then the cycle is just going to repeat itself all over again. And if the person takes care of themselves, then there will be a period of remission in which the patient will not have any symptoms for a short period of time. Deficiencies in SLE. People with SLE are known for having a deficiency in complementary proteins such as C1, C2, C3, and C4. This is important because these vitamins or proteins are what help the macrophages clear up the apoptotic cells through opsonization. So without these proteins, they cannot get of the nuclear antigens that are floating around the body. If once there's a buildup of the nuclear antigens, the cells are going to become sensitized to cells, and they are going to attack. They're going to automatically attack the cells. Antigens picked up are presented to T cells, and T cells produce T helper 2 cells, which lead to B cells attacking the cells. So basically, yeah, the cells attack healthy tissues.
Okay, so I'm Viviana, and basically risk factors for lupus include gender, as Alejandra mentioned before. Women are the ones that are mostly affected by lupus. Age, people can develop lupus at any age, but it's most common for people to be diagnosed with lupus during their 20s and 30s. Race, people are it's 2 to 3 times more common in African American women than in Caucasian women. Lupus is also more common in Hispanic, Asian, and Native American women. African American and Hispanic women are more likely to develop the more severe version of lupus. Also, family history does play a big role on an individual developing lupus, because people that have had family members with lupus have a greater chance of developing it, and only about 5% of children whose mothers have lupus will develop it. You could put the next slide. So signs and symptoms of lupus, it just depends with lupus and how mild on the person and how mild their signs and symptoms are. They're characterized by episodes called flares. So basically, like, a flare is when you'll have any sign or symptom, and it'll last for a little bit. Like, let's say you have a cough, and the cough will last for a little or worsen, and then it'll get better, and it'll go away, and then it'll come back. So that's what a flare is. Signs and symptoms will worsen for a while, then improve or even disappear completely for a time. So the signs and symptoms include fatigue, fever, joint pain, and stiffness, butterfly rash shape on the face covering the cheeks and bridge of the nose. So that basically looks like when somebody has a sunburn. You'll see it like right here. Skin lesions will appear or worsen when exposed to the sun, and this would be considered like an environmental factor. People become sensitive. Raynaud's phenomenon, that's when if the individual is exposed to cold temperature, or if they're going through a stressful time, their fingers and their toes will become like blue or white. It kind of looks like it's like under oxygenated. They will experience shortness of breath, chest pain, dry eyes, headaches, confusion, and memory loss. So these two pictures, the girl with her face, that would be like the butterfly shaped rash, and then Raynaud's phenomenon, that's how the fingers will look when they're exposed to stress or cold temperatures. Okay, so diagnostic methods, lupus can be a bit difficult to diagnose because signs and symptoms do vary from person to person. It takes several tests to diagnose for lupus. The combination of tests, signs and symptoms, physical examinations will help find a lead to help diagnose the person's case of lupus. So the first method they use is lab tests. So they do CBCs, and basically what that is when they test how many red blood cells, white blood cells, and leukocytes or like platelets that you have in your body. They will do an erythrocyte sedimentation rate. So this basically is, and this is a picture that I provided here. That's when they take out your blood. They just time it within an hour, with a time frame of an hour, to see how fast the red blood cells will sink to the bottom of the tube. A faster than normal rate indicates a systemic lupus. The sedimentation rate is not specific for any disease, but if it is elevated, the person may have lupus, an infection, or another inflammatory condition or cancer. They also do kidney and liver assessments. Kidneys and the liver are the main organs that are attacked by lupus. They do urine analysis, and this may show an increase in a protein level or RBC in the red blood cells in the urine, which may occur after lupus has affected your kidneys. And they have anti-nuclear antibody tests. A positive test for the presence of these antibodies produced by your immune system indicates a stimulated immune system. So another method they use is chest x-rays or imaging tests. So the first one would be a chest x-ray, and this will review any abnormal shadows or fluids that you may have in your lungs. So the first picture of the lungs on top, that's like your average, your normal x-ray of your lungs, and then on the bottom you'll see that you'll have like fluid buildup, or they don't look as clear as the normal one. They'll see abnormal shadows. You can also do an echocardiogram, and this is when they use sound waves to produce real-time images of your heart beating. It checks for problems with your valves and other portions of your heart. They also do biopsies. Lupus can harm your kidneys in different ways, and treatment can vary depending on the type of damage that has occurred. In some cases, it's necessary to test a small type of kidney tissue to determine what treatment is going to be the most effective. The sample of the tissue can be obtained with a needle or through a small incision. Skin biopsy is performed to confirm a diagnosis of lupus affecting the skin. So treatments include, since lupus is a chronic condition and there is no cure for it, meaning like it won't, like once someone is diagnosed with lupus, they can't be like undiagnosed, like they'll be living with lupus for the rest of their life. But there is treatment that can help manage the signs and symptoms, prevent flares, and prevent other health problems that is caused by lupus. So treatment just depends on the individual symptoms and needs. So they're basically just treating their signs and symptoms. So a common way is non-steroidal anti-inflammatory drugs, and these can be used over the counter like Advil and stuff. So it could be like to treat pain, swelling, and fever that are associated with lupus. And side effects of NSAIDs include stomach bleeding, kidney problems, and an increased risk of heart problems. They can also do anti-malarial drugs. This is often used to treat malaria. It affects the immune system and can help decrease the risk of lupus flares. Side effects include an upset stomach, and this is like a very rare side effect, is damage to the retina of the eye. So that's why it is recommended for the patient to get like normal eye exams. They also use corticosteroids. This is a prednisone, and other type of corticosteroids can counter the inflammation of lupus. Side effects include weight gain, easy bruising, osteoporosis, high blood pressure, diabetes, and increased infection. And they also use biologics. Yes. It's administered through the IV, and it reduces lupus symptoms in some cases. Some side effects include nausea, diarrhea, and other infections. So with lupus, since it is a systemic disease, there's other parts of lupus disrupts other parts of your body. So you can develop lupus arthritis, and that just causes pain, stiffness, swelling, tenderness, and warmth in your joints. It does affect the skin. 66% of people with lupus will develop some form of skin disease, and 40 to 70% of people with lupus will find that their disease is made worse by exposure to UV rays. So that's where the photosensitivity comes to play. Chronic cutaneous discoid lupus, cutaneous and acute cutaneous lupus are different forms of diseases that is caused by lupus for the skin. The kidneys are also disrupted because lupus can cause inflammation in them, making them unable to properly remove waste from the blood or control the amount of fluids in the body. The lungs are affected the most common way is through the inflammation of the pleura. Pleuritis is a sharp, you'll feel like a sharp stabbing pain in specific areas of the chest. 40 to 60% of people will develop pleuritis. Also, the heart is affected through a cardiovascular disease is one of the leading complications of lupus. This is a result of building the buildup of fats, cholesterol, and other substances on arterial walls, and this is called atherosclerosis. The blood, lupus may cause anemia, thrombosis. Patients may need blood transfusion and have bone marrow testing. And it also affects the nervous system. So it affects the central nervous system because patients may become depressed. They may experience seizures, strokes, vision problems, mood swings, and they may have a difficulty concentrating. It affects the peripheral nervous system because of the vision problems. They may experience facial pain, ringing in the ears, dizziness, drooping of an eyelid, and carpal tunnel syndrome. And also the autonomic nervous system, it may cause numbness, bruising, tingling, mental confusion, headaches, and gastrointestinal problems. So now the prognosis of lupus is way better than it has ever been before. 80 to 90% of people do live the normal expected lifespan, even though they're diagnosed with lupus. It does vary in intensity and degree. Some may experience mild cases and others may experience more moderate cases. For people that experience severe flare-ups, they are at greater risk that their lupus may be life-threatening. And this video is just like lupus summed up.
Lupus affects over 5 million people worldwide. You may have heard of it. You may know someone with lupus. But what is lupus? Let's take a look. This person is healthy. Hello. Everybody has white blood cells. They protect people from infections. This is what stops you from getting ill. In people with lupus, however, the white blood cells aren't so helpful. The white blood cells are out of control. They won't just attack infections, they'll attack anything. This is what causes all their symptoms. Symptoms of lupus can include extreme fatigue, joint pain, muscle weakness, rashes, hair loss, and it can also damage organs such as the kidneys, heart, or brain. There are a few things that can trigger symptoms in lupus patients. One of them is the sunshine. About 60% of lupus patients are sun sensitive. Another trigger is stress. It is very important that lupus patients take good care of themselves physically and emotionally. At present, there is no cure for lupus, so it can often be managed through treatment. A big problem is that it takes an average of 7 years for somebody with lupus to get a diagnosis and receive this treatment. You can help to reduce this time by sharing this video and raising awareness of this condition. Lupus mainly affects women, but it can affect anybody. To learn more, visit us at www.lupusuk.org.uk.
So yeah, these are just our references, and yeah.